Okay, so let's talk the thoracolumbar restrictions. So I want to give you a bit of an idea of the landmarks and whereabouts we're about to work. Now, the main landmark for us is to find the last rib, okay, which is not difficult at all, because basically if we draw a line up from the last rib, it sort of puts us in that cluster area of trigger points that create the thoracolumbar restriction. So if I draw a line along the last rib, coming back to the spine itself, I know that I'm going to be in the vicinity of a cluster of trigger points here in the erector spino or the thoracolumbar junction. So that's almost the first point of call sometimes for our hip extension restrictions. Now, it's a very, very simple process, the treatment. All we're looking at doing here is just trying to do some digital ischemic pressures, where we're just going to place a really broad pressure across this area here, especially where the thoracolumbar is. Now, what I like to do is I like to bring the pressure back down towards the actual pelvis itself and then lock in on those trigger points there, which you can probably feel there, Tess. So what we need to do is monitor also our pressure, and we're using, once again, the flat of our forearm. We're not using the point of our elbow because that'll be just too punishing. As I said, there's a cluster here, so we'll probably start in and around that T12 and work our way down to about L2. So just coming into the top here, once again, sinking into the tissue and then dragging the tissue down towards the pelvis and then just rocking backwards and forwards. Okay, whoops. You can feel that there, Tess. And then we just sit here and wait for these trigger points to subside. And what we're looking for is that sort of that melting moment, okay? And as that dissipates, then we can move down to the next one, and so on and so on. Now, once you've finished that, then you need to come back and then check that hip extension.